Thank you for joining us today. Please feel free to step in and out and get food. It is my pleasure and honor to be here today with the Surgeon General of the United States. You all have Dr. Murthy's bio, so I won't detail his many accomplishments, but I will say if you were here last year, then you got to see him appear with Elmo, which I'm sure was a major career highlight. We are here to talk today specifically about children and tobacco policy, including the new rules on e-cigarettes, cigars, and hookah that came out last month and are set to take effect in August, most of them. But we'll also talk about prevention more broadly and about the role of public health. Dr. Murthy and I are going to chat up here for a half hour or so, but then we'll turn to you for your questions, so be ready and wait for the microphone to reach you, and please tell us who you are before you ask your questions. So before we get to the new rules, Dr. Murthy, why don't you explain for those who don't follow this closely, when exactly did the federal government start regulating tobacco?
Well, it's a great question. You know, what's very interesting to me is that many people in America think that we beat the tobacco problem we have years ago in the 80s and 90s. They remember stories about a big lawsuit that was filed against big tobacco. They remember the result of that. They remember the master settlement agreement that was reached. They remember there was a lot of news and discussion and fights around tobacco in the 80s and 90s. And I'm often shocked when I talk to folks in the public to recognize that they believe this, and they're often shocked when I tell them that we still lose nearly 500,000 people a year to tobacco-related disease, and that we still have a smoking rate that's just under 17%, which is a lot of folks. It's better than the 42% that we had back in 1964, but still quite high. So the steps that were taken to actually give the FDA authority to regulate tobacco, those steps only took place in 2009 through a law that's referred to as the Tobacco Control Act. And it's a law that finally gave the FDA the authority it needed to regulate tobacco products. Now, in 2009, after the law was passed, the FDA began regulating cigarettes and roll-your-own tobacco. But most recently, and what was covered widely in the news, earlier this year, they also issued what were called deeming regulations and exercised their authority to regulate a much broader set of tobacco products, including e-cigarettes, hookah, and cigars.
And why were these rules needed? I mean, why couldn't FDA just regulate them because the law gave them the authority in 2009?
Yeah, it's a good question. So the FDA focused on cigarettes first, but what we have realized is since 2009, we've actually seen a dramatic increase in the prevalence of e-cigarette use. And just to give you a sense of this, between 2011 and 2015, there was nearly a 900% increase in the use of e-cigarettes by kids. So much so that now more high school kids smoke e-cigarettes than smoke traditional cigarettes. And that's a staggering development in a pretty short period of time. And if you look beyond e-cigarettes, what you see also is that the rate of hookah use has also increased dramatically, and that cigars are being smoked by children as well in almost equal numbers to cigarettes. So this is a real challenge that we have, because at a time when much of the country thinks that we beat tobacco and that tobacco use is on the decline, we've actually seen the use of these products, particularly e-cigarettes and hookah, actually rise dramatically among our kids.
Now, there's a perception, at least, that e-cigarettes are safer than tobacco that you actually smoke. Is that not the case?
Well, it's a tough question to answer because we don't actually know what's in e-cigarettes. And there are misconceptions out there about e-cigs. Some people think, for example, that e-cigarettes are harmless, that the vapor that comes out of there is harmless water vapor. It's actually not the case. Most e-cigarettes actually contain nicotine, which is a tobacco product. And we know that the vapor that comes out also contains nicotine. Nicotine is extremely addictive. It's also a chemical that has harmful effects on the developing brain, so particularly in the adolescent brain, on the brain of a developing fetus. So we have to be concerned about both the people who are using e-cigarettes, but also the people who are around them who may be exposed to that vapor. But the truth is that in order to really understand just how dangerous or not dangerous e-cigarettes are, we've got to know what's inside them. And that's actually one of the things that the deeming regulations help us do. Because before e-cigarettes were regulated, there was no requirement for for companies that were making e-cigarettes to disclose ingredients. They could make health claims and that weren't necessarily checked and validated by the FDA. For example, they could say, this is going to make you healthier. This is less dangerous than any other alternative on the market. This is harmless and safe for kids. And nobody was there to actually check and make sure that those claims were in fact accurate. And that's actually why the regulation is important. So now we can finally start to understand what's in these products so that we can assess their safety. And it'll also help make the products more consistent over time. When the CDC has actually looked at some of the products that are on the market and done analysis of the composition, they've actually found significant variability. In some cases, in addition to the nicotine, they found elements of glass. They found evidence of metals there. They found organic compounds, some of which are known to be carcinogenic. So there's been a wide variety of things out there. And my belief is that if we're going to put this on the market for people to use, we should know that they're safe.
A lot of the issues surround the marketing of tobacco products to children. I'm old enough to remember when we had the little candy and gum cigarettes that they sold at the drugstore. And now we're seeing sort of liquid nicotine products that are named after popular candy and popular cereal brands. Is there anything in the new rules that will stop that?
Well, so a couple of key things to know about the new rules. Perhaps most importantly, it now makes the sale of e-cigarette products, of all e-cigarette products, whether flavored or not flavored, illegal to minors. So that means that a store can't sell them to minors. It also means that you can't put e-cigarettes in vending machines, especially if they're in areas where young people may access them.
Is that happening now?
I'm sorry?
Is that happening now? I know that regular vending machines have been banned. Are there?
Yes, so we've heard some reports, of these being in vending machines as well, and we know for certain that they're just very easy for kids to get their hands on. So that's one of the most important things that the deeming regulations do, is they make it illegal to sell e-cigarette products to kids. But the other two things they do, which are worth noting, is that they also have rules in place now which prohibit companies from making claims about health benefits of e-cigarettes without first having them validated by the FDA. So that's important for accountability purposes. And the third piece is that they're going to help us actually understand what's in them. Because now, before e-cigarettes actually come onto the market, the companies will actually have to submit data about the product, including a safety assessment and profile about the public health impact of that product, but also including the ingredients. So we'll be able to assess that. The FDA has actually given some time for the companies to be able to comply with this rule. So there's actually a 3-year time frame here. But the provisions of the law, particularly around barring sale to minors, that will go into effect 90 days from the rule. So that tacks to about August, if I remember the dates correctly.
Yes, it is August. What about e-cigarette products that don't have nicotine in them, or say they don't have nicotine in them? There's no authority to regulate those, right?
Well, if an e-cigarette product does not contain nicotine, then if it's not a tobacco product, then yes, it would not fall under the regulatory umbrella, because this is. But what we know is that most of these e-cigarettes actually do, in fact, contain nicotine, which is a tobacco product.
But the ones that don't. Presumably, so one could see that perhaps the industry might move to non-nicotine products.
They may. We'll have to see what the industry does. But one of our biggest concerns has been the nicotine itself, because look, we know that nicotine is highly addictive, and I know this also not just from the data and the numbers, which I know and I've looked at, but I know it because of my own experience actually caring for patients who have been hooked on cigarettes, and I have found that quitting cigarettes is one of the toughest things for people to do. Many of you may know family or friends who have tried quitting cigarettes. Some of you may have even tried yourself. And you know that it's incredibly tough to do. The craving for nicotine is incredibly powerful. And that's a concern we have with kids being exposed to nicotine at a really early age. There are some people who say, well, this is different because it's not a combustible cigarette. We're not actually burning up stuff, and hence it's less harmful than e-cigarettes. And that may very well end up being the case. We'll have to let the data answer that question. But the nicotine addiction is concerning because there is data from the CDC and now most recently from others showing that kids who smoke e-cigarettes are more likely, significantly more likely, to be open to smoking traditional cigarettes as well. And that's our concern. We don't want kids to be starting off with e-cigarettes and that to lead to the use of traditional cigarettes and then other tobacco products as well, including hookah and cigars.
So you've sort of anticipated my next question, which is, where are we with kids and tobacco? Are we making progress slowing the uptake of tobacco use, or is it just shifting to other modes?
Well, I think overall, I think we have made a lot of progress over the years, and we've seen overall, even if we look at the last few years, that fewer kids are smoking cigarettes, and overall, I think we can feel good about the efforts that we have put into tobacco control. And it's worth noting that these were not just legislative efforts, but to really make the progress that we've made on tobacco, it required communities to come together to, for example, put in place laws that protected people from secondhand smoke, including clean indoor air laws. We now have a significant portion of the country that's covered by clean indoor air laws. Not everyone, and so we still have more progress to make. But it took communities being involved, it took teachers helping to educate students, it took parents talking to kids, and helping lead by example. And so together we've made a lot of progress on this, and we're gonna have to do the same thing, it turns out, with e-cigarettes, cigar, and hookah. Most people are shocked to realize that until the deeming regulations came out this year, that it was legal for children to buy cigars. I mean, can you believe that? It sounds insane, and it actually was insane. And that's why we have these regulations here. But it's gonna take more than the law itself, or than the regulations rather. It's going to take families, again, coming together to educate their children, teachers educating their kids, and mayors and other local elected officials helping to expand our work on smoke-free and tobacco-free spaces to make sure that e-cigarette type products are included in the tobacco-free spaces. Because this is a point of confusion for folks. And in fact, I should say e-cigarettes broadly is a topic that's confusing to people all around the country. And I hear it because people ask me questions all the time about them. I was at the US Conference of Mayors recently, and a number of the mayors actually raised their hand and they said, what are we supposed to do about these e-cigarettes? Are we supposed to include them in clean indoor air laws or not? Are we supposed to be pushing for more regulation or not? I ran into a teacher a few months ago who told me that her kids are smoking e-cigarettes in class. They can't chew gum in class, they can't smoke cigarettes in class, they can't drink alcohol in class, but they're smoking e-cigarettes because the school didn't have a rule on them. The school didn't have a rule because the county didn't have a rule, because they were waiting for somebody to tell them what to do. So there's a lot of confusion around this, and to really address this issue and make sure our kids aren't getting exposed to harmful products like nicotine, we're gonna have to not only implement this regulation, but we're gonna have to work hard to educate our communities.
I'm starting to see signs that say no smoking or vaping. I know you don't like that word, but at least it tries to make it clear that e-cigarettes come under the rubric of, no, you can't smoke in here.
Yeah, and that's great. And when just coming over here on a plane to Aspen, the air hostess made the announcement before everyone, fasten your seatbelts, no smoking, and no use of e-cigarettes in the plane. And I thought that was great. I think there are certain industries, the airline industry has been one, which have been very forward-leaning in making sure that e-cigarettes are included when we think about keeping spaces tobacco-free. And the term vaping is interesting. A lot of people actually don't, if you ask them, do you use e-cigarettes, they'll say no. If you ask them, do you vape, they'll say yes. And they don't often realize that they're actually one and the same. And I'm talking about kids in particular. So, it's the term sometimes we worry about, because vaping, it sounds like it might just be harmless water vapor. And it's actually not the case. The vapor has nicotine. Not good for the person having it, not good for folks who are being exposed to it secondhand. But the term is being used just to make sure that people recognize that vaping is actually part of what we're concerned about, and it's not a harmless activity.
Well, we're talking about things that may or may not be harmless. Thanks to the efforts of a lot of people, as you mentioned earlier, kids today know that tobacco is bad. They're less convinced about the dangers of drugs, particularly prescription drugs. Where does cannabis fall in that continuum? And what do you think about states like the one we're sitting in that have made cannabis legal, at least for adults?
Well, it's a good question, and I think it raises a good point, which is that there are a number of substances that have adverse health effects that kids and the people more broadly in our community think of as benign, right? Prescription drugs are one, and we just did a session earlier on opioids. We were talking about the fact that there are children around the country who are getting together on Friday nights and Saturday nights having pill parties where they're pooling prescription medications from their parents' medicine cabinets, mixing them up in a bowl, taking a handful, tossing it back, and seeing what happens next. And it's because many of them actually think that these pills are harmless. They were written by a healthcare professional, after all. What could happen to you? That's how they think. But we know, all of us, that these medicines, they have some benefits, but they also have some potentially adverse effects, especially when not taken in the proper way. And marijuana is also one of these examples of of a product that many people think is relatively harmless. But people don't realize that marijuana actually has adverse effects on the developing brain. So again, similar to e-cigarettes, we have concern then both for adolescents who use marijuana, but also for pregnant women who are either using marijuana or may be exposed to marijuana because of the developing fetus. And part of the challenge here is that when we go out and we tell kids, don't do this, 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 after a while, they start tuning out. And I think that part of the challenge we have in helping inform kids about prescription opioids and about the potential harmful effects of marijuana is I think that sometimes a lot of kids tune out to those messages. So to me, what that means is that we have to be more creative about how we reach kids. We have to use creative messages, but we also have to be thoughtful about the messengers that we're using as well. This is why peer education actually becomes really important. This is why people who are trusted members of a community become really important, whether they're faith leaders, whether they're teachers, whether they're business leaders, or whether they're parents.
I guess the question though is, if kids are learning now from a young age, smoking is bad, don't do it, tobacco is bad, and now we're going to start teaching them that don't use your parents' prescription drugs either, that's not bad. Is it not natural that some of them would then turn to something like marijuana?
Well, so two things I'd say. One is that we can take some examples actually from our experiences with food, right? Where we know that if we just tell people what not to eat all the time, don't eat cake, don't eat pie, like don't have soda, don't do this, don't do that, after a while they just get frustrated and they either tune you out or they just throw their hands up and they say, well, what can I eat then? And then eating becomes a chore instead of a source of pleasure. And what we've learned a little bit from that experience is that it's not just enough to tell people what not to do, but we have to actually be proactive in telling them what to do, right? So that means for kids as well. Like many kids may be using prescription drugs or marijuana because they want to feel good, right? So the question is, what else can we provide in terms of opportunities for kids that will allow them to have fun in a way that's healthy and safe, that will allow them to enjoy themselves? If we don't provide those alternatives, then just telling kids not to do things is not a particularly effective strategy. You asked about Colorado, since we're right here. And Colorado is, I was here at Aspen last year, and we talked about marijuana then as well because we were in Colorado again. Colorado is a state that has legalized both medical and recreational marijuana, as many of you know. There are some other states that have done that, including Washington State, Oregon, and Alaska, and recently the District of Columbia. But the challenge we have here is that policy that's being made right now at a state level around marijuana is way ahead of the science around marijuana. And you can see this actually with medical marijuana, where while when a state legalizes marijuana for medical use, what we really need, if that was going to be done, is a good science that tells us what conditions it's effective for, in what doses, for which specific people, what side effects to look out for, and what's the appropriate way to both dispense and take that product. That's what we do for for every other medication that's FDA approved. But the problem is we don't actually have that data for marijuana. And so what you see...
Because researching it is illegal in most cases.
Well, I would say, rephrase that, and I would say because research on marijuana is more difficult than it should be. And the barriers to research are a big challenge. And one thing I'm happy about is that the Obama administration has actually taken steps to reduce some of those barriers, including increasing the supply of research-grade marijuana that's available to use, including also pulling down a review process called the PHS review process, which was another administrative barrier to doing research. And there's more and there are now over 60 trials that are or 60 research studies, I should say, that are being funded on marijuana by the NIH, by the federal government. There's more obviously to do to reduce barriers to research. But the bottom line is, whatever the reasons are for not having the research, if we don't have clear data that tells us a product is safe and effective for use for a medical condition, then we shouldn't be using it, because otherwise we're creating additional risk, and we may not even fully appreciate what those risks are. And that's my primary concern with marijuana. I think marijuana is an area where we should let the science guide us when it comes to policy, and when we don't have enough science, we should find ways to get it. My concern is that when we race ahead with making marijuana accessible for medical use without that data, then we're just creating additional risk.
So the Surgeon General is the nation's chief public health officer. But since Luther Terry, as was mentioned at the outset, Tobacco's been one of the issues that the office has been most closely associated with. So where does tobacco use fall on your personal list of policy priorities?
Well, tobacco use is always on our priority list. It's been a long standing tradition in our office, as you mentioned, starting with Dr. Terry's first report on tobacco use in 1964. And that was important because it helped kick off a half century of work on tobacco, which helped bring us from, again, a smoking rate of 42% in America to just under 17% today. And so we want to keep up those efforts. So every Surgeon General since Luther Terry has made it a point to continue the fight against tobacco with the ultimate goal of having a tobacco-free America. And that might seem crazy that one day we can get to a place where kids aren't smoking cigarettes, where they're not using hookah, where they're not exposing themselves to, to cigar smoke and combustible, toxins. But I believe we can get there because we've made a tremendous amount of progress. But it's only going to happen again if we keep tobacco on our radar as a critical problem. There are other issues that crop up from time to time, and it's easy for us to get distracted by those. And it's not to say that those other issues aren't important. We know that the prescription opioid issue is a real crisis. It's one of the priorities for our office. We know that there are other problems that come up as well, like Zika and other infectious challenges that our country has. So we got to focus. But we can't take our eye off the ball when it comes to tobacco. And that's why I get concerned when I travel and I hear people tell me or pose a question to me, didn't we already deal with that tobacco issue back in the 80s and 90s? And the truth is no, because tobacco is still the leading cause of preventable death in America. When you think about that, the leading cause of preventable death, we still lose 500,000 people, about 480,000 to be exact, every year from tobacco-related disease. I mean, that's an incredible number of people, and those are our family members, our coworkers, our neighbors. So we have to keep this fight up, and what I'm happy to say is that I do think the deeming regulations are going to be an important step forward in that regard, because we got to make sure it's not just cigarettes that we're dealing with, but that it's all tobacco products.
So one of the pillars of public health, obviously, is prevention. I get why the emphasis is on not getting people not to start using tobacco products. But what are we doing for people who are already hooked and want to get off?
Well, good question. So cessation services are incredibly important for folks who are currently using tobacco products. And the good news is that we have a number of FDA-approved products to help people quit smoking. And we also have quit lines that have been set up to help people who are thinking about how to actually get started. The challenge often is that it is twofold. One is that people don't always know how to get help. Two, they may not always have insurance coverage to get access to cessation tools. And three, that they often relapse, right? So in terms of solving those problems, we got to make sure that everybody knows how people can get help, and in particular that clinicians are asking patients about smoking. And it might seem obvious to you, but if I gave you the list of things that clinicians are told to ask about in a 10 to 15 minute primary care visit, you would be astonished. You could probably spend hours trying to go through that list. But it's important that we find a way that patients are asked about smoking. It doesn't always have to be a doctor that does it. It could be anyone else who's on the care team, but somebody needs to ask about smoking so that we're ready when that window presents itself. But on the coverage side, this is actually why the coverage expansion under the ACA was so important, because cessation services are actually part of the essential benefits that now have to be included in all insurance plans. This means that not just for government insurance, but even for private insurance, cessation has to be included. And so the ACA's not only inclusion of that provision, but expansion of coverage has actually been incredibly helpful in ensuring that cessation services across the board are available to folks who need them. But it's also why Medicaid expansion is so important, because unfortunately there's still many states where Medicaid hasn't been expanded, and the result of that is that there are millions of people who are falling into a coverage gap. They make just enough to not qualify for Medicaid as it currently exists in their state, but not enough to actually afford to buy health insurance on their own. And so for those folks, getting access to cessation services is really challenging because they don't have the money to actually pay for it. So there are barriers that we have to overcome, but we do have proven cessation tools that work. And the more we can get people access to them, the more we can get people covered, the better chance people have of actually being able to quit.
One of the problems with prevention, which is obviously a big part of your job, is that in most cases, budget experts say it does not pay for itself. If people stop smoking, for example, they live longer and end up costing more in Social Security and Medicare benefits. Now, it's true that with children, prevention really does pay, particularly things like immunization and nutrition programs. How should we better look at the cost of prevention, and is that one of your goals?
Yeah, so I'm glad you brought this up. So prevention is a very high priority for me. And one of my concerns has been that prevention is common sense, right? Almost everyone knows you'd rather prevent diabetes than get it and treat it later. But that common sense isn't reflected historically in how we have invested in health as a country. We've put the majority of our resources into treatment. We haven't put enough resources nearly into preventing many of the illnesses that we are now dealing with. And that's a script that we have to flip. There has been this argument that has been posed that prevention isn't cost effective, that it's actually not going to save us money and may in fact cost us more money in the end. I don't actually put a lot of faith in those kind of assertions because I don't think that they are clear comparisons that compare apples to apples. And let me explain to you why. Because when we talk about prevention, we're not just talking about getting a screening colonoscopy or getting a mammogram. When we talk about prevention, we're actually thinking more broadly about community prevention, right? So that means, can we build our cities in ways that actually promote physical activity, both because we have sidewalks, but also because our neighborhoods are safe and people can actually get out and walk? When we do that, when we have more green spaces and safe spaces, we know that people actually engage in activity and they're more physically active, and that contributes to better health. And the contributions are not minor and negligible. If you can get people walking on average 22 minutes a day, walking briskly, you can actually reduce their risk of diabetes by 30%, their risk of heart disease by 20%, their risk of sudden death by 20% as well. These are powerful impacts with something as simple as walking. So, and additionally, if you think about the food that our children eat in school, right? If we can focus on making sure that they have healthy options available to them, if we can expose kids to fruits and vegetables early on when their taste preferences are developing, if we can actually get them involved in building community gardens, which is something I've now seen at a growing number of schools around the country, these can be powerful tools for changing what kids eat both in school and outside of school. So when we actually talk about prevention, we have to remember that prevention includes all of that. It's not just what a doctor does in his or her office. And when we think about prevention that way, then my belief is actually that prevention actually does pay, because people will live longer. That's good. That's what we want, just to be absolutely clear on that. The second, it's true, yes, when people live longer, they may incur additional costs, Social Security costs, medical costs as they get older.
They're going to die of something else eventually.
They may die of something else eventually. But the truth is, the longer people live, the more we have to spend as a society because we have to support them in some way. But that's okay. That's a cost that we're willing to put up because we want our people to live longer. The flip side is that they also contribute to society in ways that we can sometimes measure and in ways that we can't. We know, for example, that all of us have grandparents, or had grandparents at some point, right? And if you were, like me, fortunate enough to have at least a couple of grandparents when you were growing up, you know that the contributions that grandparents can make to the lives of their kids are priceless, right? How do you put a price tag on that? But my paternal grandmother was not there when I was growing up because she died when my dad was 10 years old. She died of tuberculosis, a disease which is preventable, a disease which is also treatable, but she lived in a small village in India and couldn't get that treatment. So how do you put a price on the cost of not having a grandmother there for me and my sister? How do you put a cost on my father having to grow up after the age of 10 without a mother? Keeping people alive and healthier for longer has immeasurable benefit to society. So prevention is well worth it. It's something that people want, and I think it's high time that we shift our approach to health to prioritize prevention rather than just treatment.
And can you talk a little bit more about the social determinants of health? I think people are starting to get familiar with this concept, but they don't quite link what you were talking about, that that it's not just having places to walk, but having safe communities. And we've now learned the hard way about having safe water to drink. I mean, that there's a lot of things that affect health that don't go on in an interchange between a doctor and a patient.
Well, yeah, it's a good question. So I'll tell you this, no matter what field people work in, they recognize that money is an important part of enabling them to do their work. So whether I run a bakery or whether I run a medical clinic or an investment fund, I know that I have to keep my budget and keep track of how much I'm spending and how much I'm bringing in. So it turns out, though, with health, that there's a similar thing at play, which is that no matter what job you have, no matter what sector you're in, whether it's transportation or housing, education, or health, the work that you do and the policies that you create do have an impact on health. The question is, do we recognize them or do we not? We know, for example, that when education systems actually make conscious decisions to make sure that kids have healthy food in their cafeterias, that makes a difference. When they cut time for physical education, that has adverse effects on kids' health. When departments of housing decide that they are going to prohibit smoking in multi-unit housing because of the impact of secondhand smoke, that has an impact on health. So what we are starting to wake up to now, more so than ever before, is that health, like money, is sort of the river that runs through everything. And to the extent that we don't recognize that, extent that we lose opportunities to actually improve health. So as we think about moving into a new age of prevention, we do have to recognize that poverty is a powerful driver of health. We do have to recognize that the water that comes out of your tap is an important component of health, that the food that your kids are eating at school, but also that you're eating in your workplace have a powerful impact on your health. And just think about where we are right now. We are sitting in this beautiful part of the country where we're surrounded by mountains. We are literally a stone's throw away from hiking trails, so that in between learning here, you can actually take a break and walk. You can, as I did last year, not sit down to meet with people to talk about issues, but you can actually go for a walk with them and talk about issues. This environment is lending itself to building health into our day-to-day approach to life. And that's actually the mindset that we need to develop as a country if we want to create health. We have to think, since health does run through everything, how can I use my role in my job to ensure that the people around me and in my community have a chance to live a healthier life? If you're, again, running a small business, it might be what you provide and do for your employees. It might be modeling that by actually having walking meetings, for example, or having healthy food that's available for them, or healthy snacks. In our office, we celebrate birthdays a lot because we're a very close office. We're kind of like a family, and it's like always a big to-do when someone has a birthday. But traditionally, when I have been at work and we celebrate birthdays, we bring, people would bring cookies and cake and Coke and Sprite and foods which we wouldn't traditionally think of as healthy. And it kind of becomes a problem when you're a close office that has a lot of people. Then you have a lot of birthdays and you have a lot of unhealthy food around. So one of the things that we started doing was thinking about, well, how can we make some of the offerings here actually healthier, right? So that people feel like they have at least a couple of healthy options that they can choose from. And some of this is about the real opportunity of making healthy food available. Some of it's also, though, about shifting norms, right? And so we want to create a norm in our country where fun is not always equated with unhealthy food by necessity. We also want to create a norm where healthy is not always associated with distasteful food. I've had friends who tell me that the way they figure out what to eat at a restaurant is they look at all the things that are labeled healthy and they choose the other stuff because they figure it's not going to taste very good. But that comes from a culture that we've developed that healthy and tasty aren't really compatible. So all of us have a role in creating a culture of prevention in America. We only have to look really at the opportunities like in our day-to-day lives. And I think we can see that we can not only create a healthier environment for the people around us, but we can also model it ourselves.
What do you do? I was in Louisiana last week, and I was meeting with health professionals, and they were bemoaning the fact that you have a problem there. It's great to go outside here and walk around or sit around. I was actually doing some prep work just sitting outside. It's not so pleasant in Louisiana, where it's 85 degrees and 80% humidity. Sometimes it's 95 degrees and 85% humidity.
Yeah.
And they also have all that amazing food that they have built their culture around. So I mean, how do you shift norms in a place with a lot more difficulties than Aspen?
Well, changing norms is not easy, and it's not something you can do with policy alone. What you need actually is the engagement and involvement of people who are opinion leaders and who are trusted leaders. And I'll give you a simple example of one experience I had very soon after I started as Surgeon General. I traveled down to Birmingham, Alabama, which was the first stop on a national listening tour that I was doing. And I sat down with the pastor of a large church. And keep in mind, this is in Birmingham, Alabama. It's in the South. And he told me a really interesting story. He said, I grew up here in Alabama, and I love fried chicken. And he said, but we realized some years ago that wasn't always the best thing for our congregants to be eating every day. And so we made a decision that at church, we were going to switch from offering fried chicken to baked chicken. He said, it was really hard for me. He said, we got complaints from people too in the beginning. He said, but then people kind of got used to it. And they realized, hey, this stuff actually, it tastes pretty good. And church is telling me it's actually better for me. So that's a good thing. So not only did more people start eating healthier food at the church, but he also found out that people went home and they started making baked chicken more often because they, one, tasted it at the church and realized it wasn't so bad, but also learned that it was good for you. So changing norms and culture, they take leaders doing that. Because you're absolutely right. Look, not every place has hiking trails within a stone's throw. Not every place has access to affordable, healthy food either. That's a real challenge too. But if we look closely, there are usually steps that we can take. It might be one step or two steps to actually increase our opportunity to live a healthier life. And this switch to walking meetings is one of them. But think about the fact that people, last year I'll just tell you that we released this call to action on walking in walkable communities as part of an effort to rebuild a culture of physical activity in America. And one of the groups that we teamed up with was a National Association of Shopping Centers. And you might say, well, shopping centers, what do they have to do with it? Well, it turns out that if you're living in Louisiana, if you're living in Miami, where I grew up, and you're contending with hot and humid summers, then malls are actually a great air-conditioned place where you can walk for sometimes miles and miles and miles. And so more and more people have actually now started the like mall walking programs, and that was part of the reason we built this partnership, was to encourage and expand these types of programs. My own chief of staff, actually in my office, his parents, in the evenings, they would meet with their friends at the mall, and they would just all walk and talk together. So instead of meeting at home over coffee and muffins, they would take a walk because they wanted to be healthier. And so when we think about it this way, we start to realize that if we're creative, we can repurpose a lot of spaces that exist in our communities, whether they're football fields, whether they're schools, which have auditoriums, whether they're shopping centers. And we can make them places where we can not only engage people in physical activity, but where we can also help to build community, which is also incredibly important.
Okay, I'm going to turn it over to the audience now. Someone back there has a microphone. So if you have a question, raise your hand. And please tell us who you are. Ask your question. Right up here.
Oh, sure. Hi, I'm Robert Levin. I'm a digital health entrepreneur. And I just came from an Internet of Things conference where there was an Internet of Medical Things track with biosensors. And I'm sure you're well aware of what's happening in that field, but what are the implications for digital health and monitoring, prevention, diagnostics in the cloud?
Well, it's a great question about digital health. And I mean, I'm a real optimist and enthusiast about what the contributions that digital tools can make to keeping us healthy. Because I think one of the challenges that we have when it comes to living a healthier life is the lack of feedback. And just in counting steps, that's a great example. People misjudge how many steps they're taking when they don't have an actual step device. They think they walked a long distance today, and so often they didn't walk nearly as much. So being able to quantitate the progress that you're making is incredibly important. Because if you think about it traditionally, what have been the metrics of progress that we've had to use? Stepping on a scale to check your weight, every now and then going to a doctor and maybe getting your cholesterol checked and your blood pressure checked. These are not always the best tools that we want to use to judge whether or not we are engaging in healthy behavior. And so tools that can actually help us monitor activity, that can help us not only monitor our food intake, but also understand proactively like what's healthy and what's not in the area around us. I think these are incredibly powerful. I'll tell you a challenge I have a lot is we travel all the time in my job. And when we travel and when we stop for lunch or something, we often have a moment where we stop and say, hey, does anybody know where there's a place around here where we can get actually healthy food? And figuring out the answer to that question is really difficult. You can go on Yelp and you can look at reviews, but those reviews are based on a whole bunch of factors. They don't necessarily tell you what's healthy and what's not. when you do go to places, a lot of times you can't, the information is not transparent about the nutritional facts, behind the dishes that you're actually looking at. So making healthy choices is actually, even for people who are well-resourced and educated, can be quite challenging. And I've often thought to myself, if we had tools that could actually allow us to assess and quickly do a survey of the nutritional offerings around us in any geographic area, that would make our choices so much easier. And it also would create more of an incentive, I think, for restaurants and other food providers to start tilting towards healthier options, because we do need to do more in building those incentives. So I'm a real enthusiast. And I'll lastly tell you that when I was working in Boston, the hospital that I was working at started a step competition one year. And they created teams of doctors, and they kind of pitted them all against each other. Just kind of a brilliant strategy, because many doctors are competitive and they want to win. And it was an incredible experience, because I had never counted my steps before that. And I actually was shocked at how little I was actually moving compared to what I thought. And in addition to giving me awareness, the fact that I was doing this with other people meant that we were encouraging each other. We were finding ways to help each other. Some of us were friends, and when we would hang out, we decided to take a walk to hang out instead of just sitting down for coffee. And that, even though the competition ended years ago, many of us continue doing some of these things even to today. And those digital tools were incredibly helpful. But as much as the tools are important, I do want to say that this is also about shifting culture and norms, right? Because what do we often say when we want to get together with a friend? We're like, hey, we should get together for coffee. I say that I don't even drink coffee, right? Because it's just part of our parlance. It's part of how we think. But if we were able to shift norms in a way that one day, instead of saying, let's get together for coffee, you said, let's get together for a walk, then we'd be making a lot of progress in moving us toward a more physically active and healthier country.
And yet what research there is on the, we were talking about finding healthy foods on calorie, labels or nutrition labels, particularly at fast food places, is that people don't tend to choose lower calorie options, if you will, which I actually find frustrating, because I do use them, and I do use it. It's like, wow, that thing has 600 calories. No, but I think in general, is it back to what you were saying about the menu? Is it people think that if it has lower calories, it's not going to taste as good?
So it's a good question. I mean, I think it's actually complicated, and I've heard the same data that you've talked about. But I think it really depends what populations you're looking at. I was talking to a colleague last night who lives in New York City and works in public health there. And he was telling me that when they've actually looked at data on who uses nutritional labels, and particularly the calorie data, they found that folks who are well-educated and better resourced, that they actually do use those heavily. And they've also found that folks who are at the lower end of the socioeconomic spectrum, that they actually also look at nutrition labels, although they look for different things. So I think it really matters how we break this down. And I think it also, that what that data tells me is that we also have to do a better job making sure that the data we're presenting is understandable and makes sense to people. Because right now people look at nutrition labels and sometimes they don't know what to do with everything that they're seeing. There's been, as many of you may have heard, a revision to the nutrition label very recently, which now includes a component of added sugars, which helps people understand whether they're taking in additional sugar. It also has adjusted portion sizes to make them more realistic. So you're not thinking, oh, I'm just having one portion size, when in reality you're having 3. And it also it makes certain numbers just bigger, like the number of calories, so they stand out and it's easier to draw your attention to key data on the label. So my conclusion from some of the research that has been done is not that nutrition labels are useless and should be tossed out. It's that we have more work to do to make those nutrition labels more understandable and accessible to folks. But I also think, coming back to the digital question, that this is an area where I think digital tools can be incredibly helpful. Because the fact that I have to go into a store and ask a clerk, the clerk behind the desk, to pull out some book that's hidden under some cabinet, to leaf through that and then find out what the nutrition facts actually are for a product I might be interested in, that's just too onerous. Very, very few people are going to do that. But when you have the data available in a form that people can understand, and if they actually know what to do with that data, which is the other big piece, then I think they can start to use it to make good decisions about their health.
Who else has a question? In the very back.
Hi, my name is Sydney Strymer. I'm a physical education teacher, and I was just wondering where you see the future of physical education. I'm very grateful to be working at a school that has a program in place for kindergarten through 12th grade, but I know that some schools with budget cuts don't have a program.
Yeah, well, first of all, thank you for the work you're doing in your school to make sure physical activity is still a part of the experience that children have. I'm worried about the experience that kids have with physical activity right now because many schools have cut physical activity. Many kids live in neighborhoods which don't have green spaces and parks. Many kids live in neighborhoods that aren't safe to wander out in and to walk around or simply play. And the other thing that, pardon me, that we have realized is that there are many children and girls in particular who are not brought up with basic physical activity skills, what we think of as physical literacy, which then ends up closing down opportunities for them to engage in sports or other types of activity later on. Some simple examples I'll give you, like throwing a ball. I have so many friends who are women who have told me that they can't throw because they have bad hand-eye coordination. I think maybe sometimes that's true, but I think a lot of times that's a narrative that people bought into and were told when they were very young. Because they weren't given opportunities to actually learn how to throw and how to develop some of those skills. And for the rest of their life, whenever an opportunity came up to play basketball or tennis, they said, no, I can't do that because I have bad hand-eye coordination. Whenever an opportunity came up to just go out and just play with their friends, they didn't toss a ball around because they felt they had bad hand-eye coordination. And I'm not talking about theoretical examples. I'm talking actually about my wife, Alice, who actually has said all of these things to me over time. But I'll tell you that when Alice and I started dating, we used to do this thing where, I have this compulsion to just like throw things when I'm thinking, not at people to hurt them, just to be clear, but just to throw a ball, like tennis ball, back and forth or something. And Alice and I, we would, do that with each other. But initially, when I would do it, she was sort of scared, of the ball, and she would say, no, I can't do that. But then over time, she started, just playing along, and she would catch the ball. And within a year or two, I noticed once that I would sometimes if I was just chatting with her, I would suddenly just like fling the ball toward her and she would catch it with one hand. That's pretty impressive for somebody who just like a year or two before told me that she couldn't do anything with a ball because she had bad hand-eye coordination. And what's interesting to me is that I do this in my office as well. And I just toss a ball around whenever we're thinking with the folks in our office. And I've noticed that many of the folks who said that they had bad hand-eye coordination and they couldn't throw a ball, they're now also catching one-handed. It's actually very impressive and interesting to see. So I think that what we need to do if we want to ensure that our children have a foundation for physical activity is I do think very early in life, including before, frankly, they enroll in elementary school, we have to have ways to expose them to some of these basic activities like throwing, kicking, hopping. And there's a report that actually I talked about last year here on kids and sports. Which talked about physical literacy and about some of the basic skills that all children should have that will then enable them to participate in sports or a range of activities later in life. So we have to expose kids to that. We have to protect physical activity in our schools. And part of that is helping school administrators and also our legislators understand that physical activity in schools is not a luxury. It's not something that's just nice to do and it's just fun time for kids. It's an incredibly important part of their development and their health. And we know that if you're a teacher who's worried about behavioral disturbances in your classroom, that when kids actually have opportunities to be physically active, their behavioral disturbances actually go down, both in school and at home. So these are some of the steps that we have to take, and that's why like in this job, part of what I have done is to try to spend time going to schools which are doing a good job at that, but also go to communities which are having a tough time with physical activity and help build this in to our priorities when it comes to education and to health overall.
Who else? Oh, lots in front. Why don't we go right here first? Yeah. Wait for microphone. Oh, actually, go ahead, Matt, and then we'll come to you.
Okay, thanks. I'll be quick. Matt James with the Packard Foundation. Thank you for your great work. One of the things that could threaten physical activity and physical health the most is climate change. From being able to only walk in malls to vector-borne diseases, all of the things that Julie always reports on. How much do you feel, as Surgeon General, you should be making the connection between climate and health so that that becomes more of the discussion we're having in America today?
So that's a great question. I think climate change is incredibly important. I think it's important not just for me to talk about, but for all leaders in the community to talk about, because this is going to impact all of us. It already is impacting all of us. And it's one of the great threats that we face as a society. I've actually, early on in my term, I actually began talking about the connection between climate change and health, because many people didn't realize that there's actually a health factor here. We know that, for example, as temperatures rise and as the quality of our air declines, that has an impact on kids with asthma, on adults with asthma, on everyone who lives with respiratory diseases like emphysema or chronic bronchitis. We also know that as temperatures rise, that has an impact on our water as well. And as we've seen for example, on the quantity of Vibrio, which is a bacteria in our water. We've also recently we released actually a report on climate change and health, which it was probably about a couple months ago that we released this at the White House. And one of the things that we profiled in that report is growing understanding that we now have about the impact of climate change on the nutritional content of grains. And this is not something that people thought of before. So we have to the more that we understand climate change, the more we understand that it has manifold impacts. And many of these actually impact health. And so that is actually one of the reasons that we've been talking about climate change in my office. I'll be honest with you, sometimes climate change is an issue, sometimes it can get politicized, and sometimes people worry about, ask me, do you really think you should be talking about issues that might be a little controversial? And I think this is actually exactly why we should be talking about these issues, because what we need to do is ensure that facts are guiding us in our discussions, that science is driving our policy, and not opinion, not rumor. Unfortunately, we've seen that has been a challenge when it comes to climate change. We've seen it a challenge actually in many other areas of health as well. But it's one of the reasons that I'll be continuing to talk about the impact of climate change on health.
Okay, now down here.
Hi, I'm Emily Parento. I'm from Kentucky. I wondered if you could talk a little bit about your thoughts on the decision not to ban flavored e-cigarettes. We have some of the highest smoking rates in the country in Kentucky, and many in the public health community were disappointed in that. Do you think that's likely to be revisited anytime in the near term, or not?
Yeah, so it's a good question. The deeming regulations that the FDA issued recently were foundational as we think of them. They were a first step in bringing a whole new class of products under regulation, including e-cigarettes. But the FDA and all of HHS, we're very interested in flavors as well. And there are a number of people who have concerns about flavor, recognizing that the vast majority of kids who smoke e-cigarettes often cite flavors as one of the key draws for them. And we know that even with cigars, that the majority of cigars that kids are smoking are in fact flavored cigars. So this is, I don't want you to think that this is something that has been tossed aside. This is definitely an issue that is on the radar of the FDA. It's an issue that they want to address. What they want to do is make sure that they are pulling together all available evidence on the impact of flavors before they actually issue a ruling on it. But it is absolutely within their intention to pursue the issue of flavors so they can understand it more and then take the appropriate regulation.
There's another question right here. I think we have time for maybe these couple, and then that's probably it. Yeah, the gentleman in the gray. Oh.
Hi, Ajay Mantha from Boston. So if the 16% of people who currently smoke traditional cigarettes were to move to e-cigarettes, do you think that would have a meaningful change on the 480,000 cigarette-related deaths? And is that maybe the context? I mean, how do you think about that context versus the idea that because it's labeled a cigarette, it has the same sort of all the same negative baggage that come with traditional cigarettes?
So it's a good question. So I wouldn't say that e-cigarettes and cigarettes have actually the same negative impact, because I do think there's going to be a difference in their risk. The question is how much a difference in risk, and that's why we have to actually study them to understand that. But you asked an interesting question, because the scenario you posited is that if everyone who smokes cigarettes right now all went to e-cigarettes, what would the impact be? And this raises a question that many people have wondered about in the realm of harm reduction, where they've said, well, if e-cigarettes are maybe less harmful, maybe we should push them out and get people to use them and switch off of regular cigarettes. and maybe a little easier for them than using traditional cessation devices. And so a couple of questions I would raise that I think we have to answer before we push that approach forward as a recommendation. One is we have to understand whether or not moving to e-cigarettes actually leads to a cessation of use of traditional cigarettes. And it's not entirely clear, and there's conflicting data about that right now. There's some people who switch to e-cigarettes and then don't use regular cigarettes anymore. There are others who switch to e-cigarettes but then continue using regular cigarettes as well. And so the question is, what are the numbers? Like, how does this actually shake out? What are the things you can do to support somebody if they were transitioning over so they're not using traditional cigarettes? This is the part that we actually don't fully understand. And that's why, I think just like in other areas like marijuana that we talked about with other policies, it's important that we ensure that science and data guide us in the approach that we take. And my thought would be that if we want to use e-cigarettes as a cessation device, if we've studied them and think that they are less harmful than traditional cigarettes, then what we should do is we should subject them to the same rigorous process that we would any other cessation device that's currently FDA approved, or frankly any other medicine, right? So that as a clinician, somebody knows exactly what to prescribe to their patient who's having trouble quitting smoking, so they know what to monitor, and so they know about any potential side effects. So look, I think that the bottom line is, one, kids shouldn't use e-cigarettes because there's no reason that we should be exposing kids to nicotine, which is highly addictive. Second, the question about whether e-cigarettes are effective for cessation, I think is an open question. And some people think that the government is saying that e-cigarettes don't work for cessation and that's why we shouldn't be using them. It's actually not the case. What many folks at the FDA are saying is that this is an open question. It's not answered yet. But because it's an open question means that we should get the data before we make a wholesale push to say that this is an effective cessation device. So those are two things we have to keep in mind. And what the FDA has said is that as data becomes available, they want to factor that in to their decision making. And that's what we should frankly be doing with any tool that we want to put on the market that we think might improve someone's health.
Well, thank you. I apologize, we've run out of time, but I assume that the Surgeon General is willing to take a couple of questions when we're done. I want you all to join me in giving a warm thank you to Vivek Murthy.
Thanks, everyone. Good to be with you.